So my name's Jane Wolstenholme. I'm an Associate Professor of Health Economics based at the University of Oxford and one of the RSS advisors for the University of Southampton and Partners. I'm going to talk about the supervision aspects of your fellowship and how to build a good supervisory team. So what do you need to think about when planning your supervisory team? Um, Ensuring you have the right supervisor is crucial. The panel will be assessing the appropriateness of your supervisors and your supervision or mentoring plans as part of their criteria. For those at postdoctoral level, you will need mentors rather than supervisors, but the same principles generally apply. And as I go through this presentation, if there are any differences for those applying for fellowships at postdoctoral level, I'll indicate those. So as you can see from this slide, make sure you start the process early. Thought and time needs to go into finding your supervisors and mentors. It cannot be done at the last minute. Your supervisors need to engage with you in developing your application, and they need to write statements about you and themselves in your application. So you need to identify them at an early stage and also make sure they're on board and engaged with you from very early on. You don't want to be in the same situation as this poor lad depicted here. So what is the role of your supervisory team? Your supervisory team needs to help you in many ways through your fellowship. This ranges from specific help with your PhD or postdoctoral fellowship, such as providing methodological and generic research advice, helping you to plan and achieve your milestones, introducing you to researchers aligned to your research, supporting you with writing your thesis or final reports, and if undertaking a doctoral fellowship, your viva and your corrections. They also need to be there to help with your career development. So they need to help you navigate the clinical or academic world, and they need to provide you with opportunities for you to reach your potential to independence. So, for example, giving you guidance on publications, giving you opportunities to present at conferences, helping you improve your CV, for example, co-supervising MSc students or research associates, giving you a form of responsibility. So they're there to encourage you to develop your own path. And this is all similar for mentors at the postdoctoral level. But, you know, when you're putting all these in, it needs to be at a much higher level when you're putting together your application. So what makes a good supervisor, good research supervisor? You'll need to bear in mind a number of points when selecting your supervisors or your mentors. You might want a supervisor with substantial research experience in your particular research area. So how do you identify those? Well, you can look at their research outputs. They're a good indicator. Look at what they publish and the number of publications and see whether it's appropriate to their actual career stage as well. You want supervisors to be up to date in your area of interest, for example, either methodologically or in clinically or in practice or subject-wise. Ideally, you want them to stay in the same institution for the duration of your studies to make it easier to have access to them, and they can help you help and guide you with the particular host institution or setting. So if they're based in your host institution setting, they can sort of guide you and navigate you through all the intricacies involved in that. Previous experience as a supervisor is definitely a benefit, and actually it is required for primary supervisors, but there are pros and cons to bear in mind. You know, the prestigious but very busy supervisor versus the more junior but available, you need to weigh up those pros and cons. You can also, I would suggest, talk to previous mentees or supervisees and find out their experience of that supervisor. And obviously it's useful for your supervisor to be organised. So if you know in advance about their organizational skills, that's always, a bonus. So talking to previous mentees or supervisees is good. Make sure that they have, they're going to be able to set clear expectations, that they will set deadlines for you, but they will offer flexibility as to what, it's about you and their relationship. But most of all, they're willing to help and available for you. So think about that in advance. So, it's a good fit for you. You need a good supervisory team that's a good fit for you and your research. They need to be enthusiastic about your work, inspiring about their own interests themselves and inspire you. Be a good mentor when the graft is really required. But it's up to you. You need to think about whether you want a very hands-on supervisory team or a hands-off supervisory team, and you can navigate that early on. You want your supervisory team to be able to cover the methods involved in your research. If you're a clinician or a practitioner, a clinical or practice problem that you're in, and they can guide you, aspects of training and milestones to keep you on track. So how do you go about selecting your supervisors? So this is in line with the NIHR guidance on this. This slide presents the requirements for those applying for the NIHR fellowship streams. So for the doctoral award, you must provide details of at least one academic primary supervisor and at least one other academic supervisors. You can add more supervisors with justification, but think about how you'll manage having more than that one supervisor. And indeed, if you have more than the primary and the other academic supervisor, think about how you're going to cope with more than two supervisory teams. Consider your supervisor's experience, how they're going to maintain contact with you, and managing communication, and how you're going to perhaps manage the meetings and the conflicting advice where you have more than two supervisors. For the postdoctoral, the NIHR state that they want you to have at least one academic mentor, and this depends on your needs and the methods that you might be proposing in your research. So you can have more than one academic mentor, but again, with justification as to what they're going to provide for you. Ensure that they support both your research and your career development, and select those experienced with the research process, so that they can understand your weaknesses and strengths and understand the demands of your chosen training and development program. There are obviously different models of mentorship. You can decide on what's right for you, but describe it within your application. Mentors can be outside your host institution and can be from other countries. For example, it might be linked to a research visit to their institution and they might be one of your mentors. So you can describe that in the application. Now, this slide is about those applying for fellowships with the element of professional practice or clinical work and professional training also within it. And they actually need to find practice-based supervisors on top of their academic supervisors and mentors. So for the doctoral award, you'll need your academic supervisors plus a practice, at least one practice supervisor and up to 3 practice supervisors. They are there to support your professional skill set and opportunities for wider experience and give advice on the broader professional development. In the postdoctoral award, in addition to your academic mentor or mentors, you can have 1 to 3 professional practice supervisors. Note when completing the application form, you need to select mentor option when adding the academic mentors and select the practice supervisor when adding your practice mentors or practice supervisors. So where on the application form do you write about supervision? There are actually a number of sections you can include. Now, obviously, there's the key one, which is the support and mentorship section. However, there are other sections where you can mention about your supervision or mentors or practice supervisors. You can mention it in your career development section. And you can potentially mention it in your project management section in the research plan, especially for the doctoral awards. And whilst you have the specific sections of the application on your supervision and mentors, reviewers will be able to gauge the input your supervisors have on your application in general, especially at the doctoral level. So at the doctoral level, make sure that you mention about your supervisory team throughout. Your supervisory team will be assessed in terms of their suitability and experience. And at doctoral level, your choice of supervisors is critically important. You will not get through the shortlisting if you do not have the right people to advise you. You need people who are experts in the area you are interested in and the methodology that you intend to use. So if, for example, your project is based in social science, but you don't have support from an academic social scientist, your application is unlikely to progress. You will also not get through if your supervisors have never supervised a doctoral student to completion. So for your primary, you definitely have to have that. And remember, this is a training award, and you will need people who understand your requirements as you progress through the doctoral, your PhD. And for postdoctoral level, this will include your mentoring team too. So what do you include on the application form? For the doctoral level, you need to detail the support that each named supervisor will provide and an initial assessment of the time that will be allocated to the supervision. And this should include each proposed supervisor's expertise and why you need it for this award, the experience of their experience of supervising research, the current number of PhD students they have, and the number of PhD students they've supervised to completion. For practice supervisors, justification for their inclusion and how they will support your practice and your career development is important to document. In terms of the postdoctoral award, mentors and practice supervisors need to provide justification for their inclusion and what support they'll actually be providing you. Practice supervisors or research mentors should provide support throughout the award for both the research endeavours and the advice on overall career development. The individuals who provide practice supervision or research mentorship may or may not be based in the actual contracting organisation, but they should have a clear understanding of the research process and the demands your chosen area of training and development are likely to place on you, and what your strengths and weaknesses are and how they will support them. It should also clearly describe how the proposed arrangements will support your overall development and provide an initial assessment of the time that will be allocated to the research support process. So NIHR recognise that there's a need for mentors to develop the wider and longer term career aspirations, and they have, as well as these fellowships that they have been outlined, they also have an NIHR mentoring program, and the mentors on this program are recognised academics and senior healthcare researchers and professional leaders that are paired with you by the NIHR, and the pairing is done based on the information on the application form from mentees, and they're matched with mentors. You gain support through a mentoring this specific NIHR mentoring program for 12 months. And this application process is for people once you have received the award, the NIHR award, so that it's something that's integral in the award that you can apply for. So you already hold an NIHR fellowship award in order to get this particular mentoring program. And there are two streams. There's an early career researcher stream. So that's if you're a final year PhD student or if you're up to 2 years postdoctoral. And there's also a mid-career researcher stream, and that's if you are two plus years postdoctoral. So that's something just to be aware of if you are successful in getting either a doctoral or postdoctoral award. You can also apply for this additional mentoring. Now, here are some examples of how supervision statements are written. This one in particular is from a doctoral application, and the focus of the research is on improving outcomes for patients having shoulder operations. These particular excerpts are redacted to assure anonymity. The first extract is from the primary supervisor, and you can see that this paragraph, the first paragraph, documents the supervisor's own experience and how it relates to the application. And the second paragraph indicates how many PhD students they've supervised and are currently supervising. And the final paragraph describes how the supervision will be managed with this primary supervisor, including the frequency of meetings. This particular applicant had a number of supervisors, 4 supervisors in total, and I've added 2 more, 2 of the additional supervisors descriptions here, and you can see how they explain how they'll help them through the applicant through their PhD. So the first additional supervisor is a methodologist with experience in prediction modeling and use of big data. And the second additional supervisor is a health economist and will provide supervision for the health economic components of their research. And both also provide details of past supervision and their current supervision commitments. So these are the type of things that you would expect your supervisor to be able to write on your application. And then this final one is an example of a clinical supervisor statement. This was from a previous clinical practitioner doctoral application. It was for a mixed method study on people coming to A&E for low back pain. And you can see it describes the supervisors in terms of the clinical role at senior level and the broader background in commissioning and research, which makes them suitable as a clinical practice supervisor. And then the second paragraph outlines their their experience in supervising allied health professionals to progress into clinical and leadership roles, and describes how supervision will be managed and the frequency of the meetings. And note it also explains the relationship between the supervisor and the student, and how contacts will be maintained. These are quotes from a previous chair's report for applications for a doctoral award. And they identify the importance in getting the right supervisors involved, and not just during your fellowship, but from the very early stages, so that they can provide input into developing your application. So, for example, that first one, unfortunately, many promising candidates were unsuccessful this year because of insufficient supervision in terms of their preparation of the application itself and throughout the timescale of the proposed fellowship. So that goes back to that earlier slide on start. You're thinking about your team early on. So do your research. You need to have a clear idea of your area of interest, and you need to find experts in your area. Browse university websites, look at scientific databases, who has published, who is commonly cited in your area, make a short list and read up on them, find out about previous supervisees from and where they go, look at university and departmental facilities, and if you need to approach them and you haven't met them before, but you really would like them as one of your supervisors, approach them with a short, compelling summary of your proposed research, what you currently do, your CV, the potential start dates, and your potential funders that you're looking for. So, feel free to interview your potential supervisor or mentor, find out about them, and talk to their current research team or current students or even co-authors. And if you're moving to a new host institution, get a feel for the workplace culture there. Here are some sort of red flags to think about. If a potential supervisor is difficult to pin down for a meeting, they might be likely to treat their students like that throughout. So really have think, okay, are they going to be a good supervisor for me? If a potential supervisor seems to prefer working alone or doesn't include students as co-authors on their papers, it's unlikely that they might help you build your CV and grow beyond the actual doctoral fellowship itself or the postdoctoral fellowship. If they have too much emphasis on publishing papers, it can be a sign that their potential supervisor might lack integrity and isn't focused on helping their students in their skills development. And prospective supervisors who expect candidates to work on weekends or be on call outside of working hours are likely to be more interested in the students' productivity than their actual growth and development. So, really have a think about these things prior to putting your application together. So obviously the talks today are about the NIHR sort of fellowships that are on offer. However, there are other ways of getting PhDs. So it might be that supervisors often look for PhD students with their own ideas. So funding and supervision is automatically provided. So, for example, if you go on university websites, I know our department now is currently advertising, and there are a list of potential supervisors there and potential projects. So there are, other ways of finding a doctoral position, and some funders have schemes which delegate funds for masters and PhD studentships to universities, who then allocate places. One thing to bear in mind with this is that even though you're applying for an NIHR fellowship, ensure that you also work out whether you have to apply for to the university or your host institution for your fellowship as well. And it might be that if for PhDs, they have their own separate deadlines for those applications, so be aware of those. So I'll leave you just with some quotes about supervisors.